Hello. Welcome back to this episode. In this episode, we'll be continuing the second part of the headache we talked about. In the first video, we talked about the definition of headache, what are the categories of headache, and what are the types of headache under each category. And we also made mention of some of the causes of headache, and I'll be adding 3 more causes to the headache. So, one other cause of headache is medication. Unfortunately, headache is also one of the common side effects of medications. So, when you have a new onset headache and you recently started taking a medication, then it's time for you to go back to your doctor or your general practitioner and make mention to him about your headache. It may be a side effect of the medication. Another cause of headache is dehydration, which is highly disregarded by most people. Dehydration is one of the most common causes of headache. When you deprive your body of fluid, you don't hydrate enough, and you lose a lot of water, especially through sweat, urination, and other insensible loss of water. You tend to be dehydrated. So when this happens, you'll be having headaches. And this can be easily solved by hydrating adequately, taking enough water, drinking enough water. That's all that you need to solve this form of headache. You don't need any medication to solve this type of headache. So always make sure you stay hydrated, and then you're good to go. So the last cause I'll be talking about is hormones. And unfortunately, our females tend to have more of those. When there are some hormonal imbalances, especially in the females, when they are having their menses, then they tend to have a lot of headaches, which bothers them. So for these ones, you can only manage the symptoms. You can't treat the cause because it's a necessary part of their body to undergo those changes. So you can't deny the body from undergoing those processes. So that's the last cause we'll be talking about. Now we'll be talking about the triggers. What can trigger headache? So for the majority of people, the number one trigger is bright light. Based on the research I did, about 50 and above people get headache when they are exposed to bright light. In fact, myself inclusive. So a headache can be triggered by bright light, and it's very important to note that. Another thing that can trigger headache is certain foods. Okay, so when you take certain foods, they are able to give you headache. For example, caffeine. When you take a food that is rich in caffeine, you are likely to have headache. People also take wine and get headaches. Another group of people, when they take chocolates, they get headache. And some too, when they take cheese, they get headache. So you have to be aware of these foods and then make sure that you know which group you are. If you are the type that gets headache after you've taken chocolates, then you have to avoid taking chocolate. That's the solution. And if you are the type that gets headache when you take cheese, then you have to avoid taking cheese. That is the solution for you too. And then the other trigger we talk about is the most common, okay, among the rest of the triggers, apart from the lights. So that has to be stress. Stress. A lot of people get headache when they are stressed out, okay, especially emotionally. People get stressed up emotionally and people get stressed up physically. Both of them can cause headache. Okay? So when you have such headache, you have to make sure you stop the factor that is precipitating it. Whatsoever you are doing that is giving you emotional stress, whatsoever you are doing that is giving you the physical stress, you need to put a break on it. For physical stress, it's easy. You just take some few days to rest and you are fine. But for the emotional stress, you may need a psychiatrist to help, especially if you have already gone into depression. You may need a psychiatrist to see you and then put you on maybe some antidepressants that will help with your headache. So the other thing too is sleep. Sleep. Sleep deprivation can give you headache. It can trigger your headache. Okay? Maybe you are already somebody who is genetically exposed to having migraine, and you deprive yourself of sleep. You can trigger your migraine. You can get headache. And the second component of sleep is when you have too much sleep too, you get headache. So make sure you don't have too much of sleep and you don't deprive yourself of sleep. So the question now is, how much sleep is adequate for an individual? Well, for the normal adults, the number of hours that is adequate for you is ranging between 5 to 8 hours. 5 to 8 hours a day is okay. It can be termed adequate. So this is very important. Too much sleep can also cause headache. Okay, so now let's go to the management of headaches. We are going to talk about the possible way of managing headache. When we talk about the management, it includes the diagnosis and the treatment. So before you diagnose somebody of a certain form of headache, you have to make sure you have taken the necessary history, or as an individual, you should assess yourself, study your headache, know how it comes, how it goes. Are there any possible factors that causes it? Are there any possible foods that you eat that makes you get the headache? Does the headache come at some specific time of the day, some specific time of the month, of the year? You have to assess yourself and know all this in order to come to a conclusion that you have some type of headache, either primary or secondary. So now, when you have that done, you have the first line treatment is rescue medication. And this is because if you already have the headache, the best we can do is to alleviate your headache. And that can be done by giving you medications. So you call them rescue medications, and they are essentially the pain medications that you get, the paracetamol, the ibuprofen, and the other pain relievers that we have in the market. The next thing is prevention. Once you make a diagnosis of headache and you find out that the headache is associated with a certain factor or is triggered by a certain factor, then you have to make effort to prevent it from happening again. Then the next thing is lifestyle modification. As I mentioned earlier on, if it is something that is related to stress, make sure you seek the appropriate help to alleviate the condition. The next thing is, if the headache is so severe such that it is not something you can treat on your own, then you have to see a general practitioner, you see your medical doctor, and then you will possibly recommend an inpatient management for you. And the necessary steps and investigations will be taken in order to get you get the headache off. So the next thing we are going to talk about is when you have headache and it is related to stress, especially physical stress, then make sure that you rest, you get adequate rest, rest in a quiet and dark room. Okay, and this will help. You can also do cold or hot compresses. This can also help relieve your headache. And then the next thing is massage. Getting a good massage or physiotherapy can help relieve the headache. And the other thing is um, taking muscle relaxants, and this one should be recommended by your medical doctor. So your medical doctor will recommend the physiotherapy, and then he will also give you some muscle relaxants, and then possibly some antidepressants to manage your headache. And if all these things are done and your headache is still not getting better, then your physician will possibly recommend for an advanced investigation such as the magnetic resonance imaging to get a better picture of the cause of your headache. I hope you enjoyed this video. I'll see you in the next episode.